We're gonna start with Pascual Paula, a Make the Road member, who is going to read a statement for us. Is Pascual Paula, can you hear?
I'm here. Estoy por aquí.
Hi, welcome. Thank you so much for being here.
Gracias, Pascual. Si quiere leer lo que usted desea leer, por favor, este es su momento.
Ok, este es el momento mío entonces.
Sí, sí.
Sí.
Ok, muchísimas gracias. Buenas tardes a todos. Para mí es un placer estar participando con ustedes en esta reunión. Mi nombre es Pascual Pablo Azuero. Soy miembro de la organización de Make the Road, Pensilvania. La organización de Make the Road, Pensilvania cuenta con más de 10,000 miembros y tenemos una membresía comprometida y basada en personas de color que es de clase trabajadora y de bajos ingresos.
What they're advertising.
Principalmente inmigrantes, trabajadores no sindicalizados e inquilinos. Juntos luchamos por la justicia, el respeto y la dignidad de nuestras comunidades y promovemos soluciones políticas que mejoren la vida de cada uno de los habitantes de Pensilvania. Estados Unidos ha sido asediado por la pandemia del COVID-19, como ya conocemos. Esta está matando a las personas por grandes cantidades, especialmente a los encarcelados y en centros de detenciones donde las higienes básicas es mínima y la atención médica es totalmente nula. Si bien la pandemia está causando muertes inimaginables y una devastación económica, el gobernador Tom Woods y los comisionados del condado Berks ignoran la demanda de la comunidad de emitir una orden de expulsión de emergencia y liberar a las familias, a las 5 familias negras y morenas y sus hijos pequeños encarcelados en el centro de detención del condado de Berks. El centro de detención del condado Berks está ubicado en Leesburg, Pensilvania, y es uno de los 3 en los Estados Unidos administrado por el condado Berks bajo contrato con el Servicio de Inmigración y Control de Aduana ICE y ha estado en funcionamiento desde el 2001. Comenzó a funcionar como una prisión familiar en el 2014 y nuevamente en agosto del 2015 un tribunal federal determinó que la práctica de detener a niños en esos centros similares a la cárcel por largos periodos de tiempo es ilegal. Además, la prisión viola la ley estatal y en febrero del 2016 el departamento de Servicios Humanos de Pensilvania y decidió no renovar la licencia para operar del centro de detención del condado Berks.
Thank you, Pascual. Gracias.
No, no he terminado todavía. No he
Okay.
terminado, me queda un poquito.
No se preocupe, tome su tiempo.
Sí, fue que perdí el guión, pero ya estoy aquí de nuevo. Gracias. El centro de detención apeló la decisión del Estado de renovar la licencia y debido a esto, el proceso de apelación, el caso languidece en los procedimientos burocráticos de la justicia y el centro continúa operando. Así que ahora la familia detenida están demandando a la administración Wolf en la Corte de Pensilvania, esperando que la Corte intervenga en su nombre o a su favor. Durante años, la excusa del gobernador para no emitir una orden de expulsión de emergencia han cambiado, pero finalmente sus excusas suenan huecas. Ahora con la pandemia que nos amenaza y que está matando a los seres humanos, la semana pasada un inspector de Pensilvania testificó en una audiencia judicial que debido a la amenaza del coronavirus, el lugar no es seguro para él ir a inspeccionar. Para él ir a inspeccionarlo físicamente. ¿Qué conocimiento de que la familia confinadas en el recinto cerrados de una prisión, sentados a los pies del coronavirus, mantiene despierto al gobernador Tom Woods? Shoot Down Berks coalición ha trabajado incansablemente para la familia encarceladas, educando e informando al público sobre la prisión familiar, la inhumanidad de encerrar a las personas durante semanas, meses o incluso años a la vez, simplemente por buscar solo la legalidad de mantener el centro abierto, mientras violan las leyes federales y estatales. Los años de negligencia y abuso de los padres y niños pequeños, a la violación repetida de una joven por parte de un guardia de seguridad, la falta de atención médica adecuada y la higiene básica. Todo esto es lo que hace de esta prisión familiar una desgracia y una parodia para la comunidad. Exigimos que el gobernador Tom Woods y los comisionados de Berks cierren el centro de detención del condado Berks y lo reemplacen con una institución que satisfaga las necesidades de la comunidad. Necesitamos acción antes de que la tragedia sea más grande. Es cuanto.
Just muted myself. Thank you, Pascual, for helping us put into context what's been going on at Berks and why we are here today. Okay. Next, we are going to be reading some quotes from families who have been detained at the Family Detention Center at Berks. And the first quote is going to be read by a CASA member, Alondra.
Hi everybody, hola, buenas tardes. Me llamo Alondra Isidoro Orea y yo soy miembro de CASA. Yo soy hija de padres inmigrantes que vinieron de México y ha llegado aquí a los Estados Unidos desde que tiene 1 año. Hoy voy a leer una declaración de una muchacha que estuvo en la cárcel con su hijo. Dice, para mí estaría bien mandar un mensaje que ningún niño debe de estar detenido. Yo viví con mi hijo. Sufrí ahí, como sufrí al lado de mi hijo. Nadie sabía el dolor. Nadie vive ese dolor como uno más que uno que lo sabe. Yo estuve en el centro con mi hijo por 2 años casi. Solo yo sé ese dolor y ese sufrimiento que es vivir en este centro. A las personas que tienen el derecho y el poder de cerrar este centro, que lo cierren, que no tengan más niños detenidos. Se llama Delmi, madre detenida por 2 años con su hijo en Berks County.
Gracias, Alondra. Prudence will be reading another quote from another family member, or from another family who was in the jail. Is Prudence here?
I think she just unmuted.
Hi everyone, my name is Prudence. I'm Gladys. Gladys was detained at the Berks Detention Center from October 2015 until January 2017. She will want to tell the person who's in power to close this place down, to close it at its time. While my daughter and I were there, we had a bad time. My daughter got sick, being locked away, traumatized us emotionally. Fortunately, we are able to get out. We are okay now. I want to tell those who have the power to close this place down, think about the children, think about their health, and how are they doing? We're taken care of. In that place, the people who are there have families in the United States who are waiting for them to open with open arms. And that's for my mother that was detained.
Thank you, Prudence. Next, we're going to have Kim, who's going to be reading a statement from Lorena, a woman who was detained at Berks.
Hi, everyone. My name is Kim. I'm going to be reading a statement from Lorena. Berks is a place where the government is supposedly providing for us. So why are they treating kids the way they do? Why do they not care if the children are sick? If they need stuff to get better? If they need milk? Why do they not give them what they need? I saw it. I witnessed it when Carlos had been sick for months. He was so skinny. He was crying so much. And I carried him in those blankets over there I brought from Honduras. I remember I carried him like this while crying, and I told the lawyer, I don't want my son to die here.
Thank you, Kim. Next, we're going to have Priya Aitken.
I'm going to read a quote from Kathy. These are the families currently in prison. COVID-19 has been known about and spreading for weeks. The staff still hasn't talked to us in detail about COVID-19. Inside the facility, no one wears gloves or masks. We never had any meeting with any of the staff explaining what the situation regarding COVID-19 is. We only learn what's going on from the TV news. On the TV, there seems to be a lot of panic and concern, great steps being taken, but not here in the facility. I'm so worried that we might get it inside because there are still around 20 people living here, not including the staff.
Thank you. A reminder for everyone who will be talking or reading, remember that we have interpretation. If we can all talk a little bit slowly so that the interpreters have time to catch up. Thank you so much, Priya. Next, we're gonna have Giovanni Nieves, a Sunrise member, who's gonna be reading another quote from a family who is detained.
Esto es de Adriana. Desde que yo, mi esposa y mi hija de 2 años llegamos al centro residencial de condado de Berks en el 18 de marzo, mi hija ha estado gravemente enferma. Mi esposa y yo hemos reportado al personal médico todos los días desde que llegamos. Ella tiene chichones alrededor de su boca, barbilla y labios. A veces sangran. Su garganta está severamente hinchada y no puede mantener ningún alimento adentro. Ella ha tenido fiebre. Aunque informamos esto al personal médico todos los días, nos comenzaron a administrarle su medicamento hasta el 30 de marzo de 2020.
Thank you, Giovanni. I'm going to be reading a statement from another member, from another person who is currently detained. Many people are still sick inside the facility. One of the families that are staying here with us, their child is severely sick and feverish. We're not well and we are scared. Since I have been detained here, I have been experiencing episodes of panic attacks. Only after my attorney requested that I be given a doctor's appointment was I seen by a doctor and prescribed some medication to be able to sleep. Next, we're gonna be having Michelle Carvajal Geist, who's gonna be reading another quote.
Hi, this quote is from Kathy. En Berks no se nos dan guantes o máscaras para usar. La única vez que nos dan guantes son los guantes que recibimos cuando estamos limpiando. El personal no usa guantes ni máscaras. Solo usan guantes cuando nos sirven comida. Cuando pedimos estas cosas, nos dijeron que no era necesario.
Thank you, Michelle. Next and lastly, we're gonna have Xavier Care from Sunrise reading our last statement.
Hi, thanks for passing me the mic. I only live 15 minutes away from the detention center, and I really hope that they get free. This is a statement from a family member that is still in the detention center, and here's their voice. We are all still together in this one building. We are scared all of the time. No person in this facility speaks our language. We cannot communicate with anyone our fears, and they cannot talk to us either. They just to make motions or sometimes find a person on the phone who can speak our language. We are not safe. Thank you.
Thank you, Xavier. And I think this really brings the point home that this is not a safe place for families. This is not a safe place for children, and they should not be detained for wanting to come to a country where they thought they would be safe. Next, we're gonna have Dr. Karen Sugarman from Doctors for Camp Closures, who's gonna be reading a statement from Ilana, another doctor from Doctors for Camp Closures, who's a pediatrician.
Okay. Okay. Can you hear me? Okay. So my name is Dr. Kate Sugarman. I'm a family doctor, and Dr. Ilana Levitis Agababa and I are active in Doctors for Camp Closure. I have actually only been outside of Berks Coalition to protest. We had a Family Doctors Against Family Detention protest once, and but I've been in many other detention centers, ICE detention centers, so I understand the terrible conditions inside. Dr. Ilana, now I'm reading in her voice, I'm a Philadelphia pediatrician. I'm licensed to practice medicine in the state of Pennsylvania, board certified in general pediatrics, and a fellow of the American Academy of Pediatrics. As a medical professional, I am urging Governor Wolf to close the Berks County Family Detention Center immediately with an emergency removal order, and for the Berks County Commissioners to terminate their contract with ICE to prevent an outbreak of the novel coronavirus now plaguing our country. The crowded and unsanitary conditions at Berks County Family Detention Center, along with limited access.
Could you speak a little bit slower so that the interpreters can catch up? Sorry to interrupt you.
Sure. No. Thank you for telling me. The crowded and unsanitary conditions at Berks County Family Detention Center, along with limited access to medical care, all but guarantees a cluster of COVID-19 infections. And any delay in its closure puts the health and safety of detention center residents and staff members at imminent risk, while threatening the health and safety of the larger Pennsylvania community. Berks County Family Detention Center, commonly referred to as baby jail, is no place for innocent young families to be detained, much less during a global pandemic. The negative health outcomes of family immigration detention, including anxiety and depression, that affect both children and their parents, have been well documented. Both the American Academy of Pediatrics and the American Medical Association have created policies opposing the use of family detention. The American Academy of Pediatrics, AAP, has been outspoken about the harms associated with family detention. The AAP has stated that family detention threatens the health of children and their parents and is not a safe or effective solution. The AAP's official policy statement concludes that no amount of time in detention is safe for children. But now, in the context of a global pandemic causing devastating morbidity and mortality, the consequences of being held in family immigration detention are far more dangerous. From an infant kept in frigid and dirty conditions to a toddler who vomited blood for days before getting sent to the hospital, poor sanitary conditions and medical neglect have been well documented at Berks. These inhumane conditions and unacceptable delays in medical attention can have life or death repercussions outside of a pandemic. But if there's anything we have learned, it is that congregate care settings are dangerous during a pandemic, including ICE detention centers that evade oversight. Although older adults and people with chronic medical conditions appear to have the highest mortality rate with COVID-19, people in every age range are susceptible to serious coronavirus infections. The medical literature is being flooded with new reports of previously healthy young adults with debilitating strokes as a result of COVID-19 infection. And the newly described multi-system inflammatory syndrome in children is a tragic reminder that we cannot assume that anyone of any age is immune to the fatal and deadly effects of COVID-19. In addition to the poor conditions, the toxic stress associated with prolonged detention is known to cause immune dysregulation and make children more susceptible to infections. It is unknown just how bad the morbidity or mortality rates of COVID-19 will be in a population of detained families and children. With COVID-19 spreading through multiple ICE detention centers, it is only a matter of time before we see COVID-19 exposures at family detention centers. Governor Wolf rightfully closed schools and playgrounds and issued a stay-at-home order for millions of Pennsylvanians in order to mitigate the spread of COVID-19. However, he continues to turn his back on the families detained at Berks, where social distancing is impossible. These families are detained in a center where they cannot follow the most basic recommendation to protect their families from disease: avoid large gatherings. With limited access to soap and hand sanitizer, the hygiene precautions of frequent hand washing is impossible at Berks. Further, Berks lacks appropriate housing and staffing to clinical decision-making for properly quarantine and isolate residents, creating the perfect conditions for an infectious disease outbreak. In addition to putting families and staff at risk, the continued use of Berks County Family Detention Center is a larger public health risk. Not only can the disease spread rapidly within family detention centers, which have a poor record of managing infectious disease outbreaks, but the detention center is not isolated from the larger Berks community. With staff members coming and going, it will be difficult to control the spread into the larger community. The families detained at Berks would not pose a security risk to the general population if released to the public. However, keeping these families detained puts the families themselves at unnecessary risk and causes unnecessary risk to Pennsylvanians. Additionally, any ill detainees will need to use local health services. With many U.S. facilities already struggling to handle the increased demand on local health services, Berks County would be safer without a potential cluster of COVID-19 infections. If Berks County Family Detention Center detainees require hospitalization, that will definitely take up valuable healthcare resources desperately needed by Pennsylvanians. Pennsylvania healthcare workers are sounding the alarm about a lack of resources and supplies, and the Pennsylvania Department of Health is already seeking alternate sources of protective masks. If we have learned anything throughout this pandemic, it is to not wait for the public health disaster, but to make calculated decisions about reducing risks before resources are drained. Now, more than ever, it has become clear how much the health and safety of our community depends on not just our healthcare system, but on our elected officials. What was once an issue of right or wrong has now become an issue of life or death. It is precisely now that Pennsylvanians are depending on Governor Wolf and the Berks County Commissioners to close Berks County Family Detention Center. They will simultaneously be protecting the lives of family who fled the dangers of their own home countries to seek asylum in the U.S., while also shielding Pennsylvanians from a possible COVID-19 cluster in our community. Thank you.
Thank you, Dr. Sugarman, for reading for Dr. Ilana, who couldn't be here today. Next, we are going to have immigration attorney Adriana Zambrona, who works with Aldea, and is going to be highlighting what is currently happening at the detention center.
Hi, thank you so much, Adriana. My name is Adriana Zambrano. I'm actually a legal volunteer with Aldea, the People's Justice Center. Aldea provides free universal representation to all the families at the Berks County Residential Center, or at least all of the families who ask for it. Today, I'm going to speak on their behalf. I'm going to raise some of their voices. Today at Berks, there's an Ecuadorian family, a mom and dad, along with their 5-year-old daughter. This family has been detained for a total of 93 days. There's also a Haitian family, a mom and a dad with their 1-year-old baby. This family has been detained for a total of 84 days. Another Haitian family, a mom and a dad, and their 2 children who are 11 and 3 years of age. This family has been detained for a total of 93 days. And finally,
I'm sorry, thank you so much for your words, but this is the interpreter. Will you please go back and speak slowly and mention the description of each of those families once again? Thank you.
I can start over. Thank you. So today at Berks, we have an Ecuadorian family, a mom and a dad, along with their 5-year-old daughter. This family has been detained for a total of 93 days. We also have a Haitian family, a mom and a dad with their 1-year-old baby. This family has been detained for a total of 84 days. We have another Haitian family, a mom and a dad, and their 2 children who are 11 and 3 years of age. And this family has been detained for a total of 93 days. And last, we have another Haitian family, a mom and a dad, and their 2-year-old child. And this family has been detained for a total of 84 days. Now, all these families are seeking asylum. In fact, one of the families is a victim of a severe form of human trafficking. Today, we took some time to talk to them about their stay at BCRC. The Ecuadorian family can only talk amongst themselves. Even though the facility insists that there are 5 fluent Spanish speakers, but the family says that there is only 1 staff person each shift with whom they can communicate. And only 1 of those staff people have been friendly enough to listen to them and hear them vent about their difficult situation. The 11-year-old, if you think about how isolated she is, she has not seen another person in her age group in over 3 months. Can you imagine who she talks to? Don't you wonder who she plays with? She says that she wants to get out of detention so that she can sing. And her favorite singers are Karol G and Shakira. Can you imagine feeling so confined that you feel that you can't even sing? One of the Haitian families describes that one of their biggest scares was when they had just recently arrived and their baby had a fever for about 3 or 4 days. Imagine being in the middle of a pandemic and having a child so sick and to have only 1 person in the whole building who can speak your language. Because again, despite the facility's assertions that multiple people in their staff can speak Haitian Creole, this family only knows of 1 person who speaks Haitian Creole. I also asked the Ecuadorian family, what is the hardest part about being confined at Berks? They said that at first everything was new and they felt hopeful. But after 93 days, they're starting to lose hope. They express, we are already just tired and bored of everything. The most concerning is my daughter. She only eats bread and bananas. She doesn't like anything else. She was never a picky eater. She used to like rice and eggs. She used to love potatoes and beans, but not here. Not the way they make the French fries and the sweet beans here. So many days we have suffered to get here. It is not so that we could end up in this place for such a long time. We want to finally be free. I also asked one of the Haitian families, what was the hardest part about being confined at Berks? The father said, The hardest part is to see my child suffering. I cannot take care of my kid because I am not free. I have to buy him soups so that I can feed him daily. And for this reason, I don't feel good as a father. I feel like I cannot love my child freely. The whole time we have been here, we have not gotten good soap for the body. They would make us use the same soap we use for our hands to use for our bodies. If it weren't for the soap that we get from our attorneys, we would wash with hand soap only or with water only. Because of this, my wife had something like a skin infection and she has lost all of her hair. She looks like a man now. I mentioned if he thought his wife's hair loss was stress related, and he said to me, my wife has always been stressed, but she had not lost her hair before. Regarding his 1-year-old, he continues, my child is so small. Every time he gets sick, it's very scary. Whenever my child eats something in this place, he gets diarrhea, so he doesn't eat well. Besides, anything could happen to my child here, and there is no doctor on the weekends. I remember the scariest time was when my baby fell on his head, and this, unfortunately, happened on a Friday. I went to the clinic and they told me that I had to wait until Monday. Anything could have happened with my baby. He wasn't sleeping. I felt like he could have died that weekend, and we had to wait until Monday. Another very difficult thing is that I don't know anything about my mom or dad. Another one of the Haitian families describes, people in prison don't move freely. Another family said, they watch you like as if we were in school. Regarding the pandemic and their ability to practice the safety precautions that we are all having to take, the families express, we are only in the hands of God to stay alive. The staff never explained to them in a language that they could understand what is so special about the virus and what are some of the practices to keep them safe. They only gather them to tell them that they had to wash their hands and wear masks. One of the Haitian parents describes that he learned about the coronavirus on TV in Spanish, a language that he doesn't understand fully. He says, it is impossible here to practice social distancing, especially with the babies. Even when the staff is watching you or standing next to you, they don't stand 6 feet apart. The tables in the dining room are not 6 feet apart. The toys are shared and they are not washed properly. The towels the staff uses to clean their office are the same towels they later give us to clean ourselves. So this is what the families have to say. And I will just add in closing, as a resident of Berks County and in the state of Pennsylvania, I think we all here have been used to the response of the governor, the thousands of times we have asked them to issue an emergency removal order to shut down this facility. And the answer has been, I can't. They say that in politics, the best way to say no is I can't. And nothing rings more true in my mind as I read these accounts directly from the mouths of the families at Berks. Because recently, Aldea and the Free Migration Project filed a lawsuit in order to keep the facility from holding families in light of COVID-19. The response from the state was to aggressively fight this lawsuit. So it is really surprising to see the state at first taking a passive stance, saying, I can't, to then turn around and so zealously spend all this energy and taxpayer resources to fight so hard to keep this place open. And if that was an egregious of a response, the response from the county leaves even more to be desired when they categorically stated that the ultimate victim of this lawsuit would be the county and their fiduciary interests. So there's that. We all know that the real ultimate victims here are the families. the young women and children who have no freedom, who can't breathe free, not even at a time as dire as this. I want to thank the coalition for giving this opportunity for the family's voice to be elevated. I really appreciate it, and I'm looking forward to hearing from others in this issue. Thank you.
Thank you, Adriana, so much for bringing the voices of the families who are currently detained to this space. Thank you for doing all the work that you do. I want to give a quick shout out to Representative Rob, Representative Leon Kruger, and Hohenstein, who are currently on the call, as well as Senator Schwenk, before we go to our next speaker, who will be Jennifer Lee, who is a professor at law at Temple University's Scheller Center for Social Justice. And Jennifer Lee is going to be explaining how Berks violates the federal and state law and what an ERO is and how the governor could issue an ERO. It's within his power.
Great, thanks so much. So as we heard from Adriana today, we know that Berks is regularly violating federal law under agreement called Flores that applies to immigrant families in detention and requires them to be released within 20 days. But instead, the federal government is choosing to detain families who come to the US seeking asylum instead of using known, tested, and proven alternatives to detention. But what I'm really here to do today is to emphasize what Pennsylvania legally has to do with a federal family detention facility. So the state of Pennsylvania makes a decision about whether or not the Berks facility should be licensed. As a county facility, regardless of its contract with the federal government, it must be licensed by the state. And that's because we have rules in Pennsylvania that state when and how children can be held in facilities. And why do we have such rules? Because the state of Pennsylvania cares about the health and safety of children within the Commonwealth. And so what we know from these rules is that Berks cannot validly be licensed under Pennsylvania law. Children under the age of 9 can't be held at a secure facility. And even for those who are over 9, they have to have had a Pennsylvania court order that commits them to such a facility. Facilities also generally can't mix unrelated adults with children together, and facilities must be sanitary, free of hazards, and protect the well-being of children. And so now more than ever with COVID-19, we know that Berks is failing to comply with these requirements. So what does that mean? What sort of action can Governor Wolf take in this situation? Governor Wolf, who actually has publicly stated that the Berks County Detention Center is, quote, wrong, immoral, and inhumane. Well, for starters, it's simply wrong for the state to claim that it has no ability to shut down family detention in Pennsylvania. And there are two things that he could do. And the first thing is Pennsylvania could stop agreeing to allow Berks to continue to operate under its now expired license from 2016 to 2017. As Pasquale mentioned, in 2016, Pennsylvania refused to renew Berks's license. Berks appealed that decision, and that appeal is still pending. In the meantime, however, Pennsylvania turned around and entered into side agreements with Berks, stating that it could continue to operate under its old license, even though it's not legally allowed to do so. So the first thing Pennsylvania could do is pull out of those agreements. The second thing, which a lot of folks have referred to, is that Pennsylvania has the authority to issue an emergency removal order where there is, quote, evidence of gross incompetence, negligence, misconduct in operating the facility that is likely to constitute an immediate and serious danger to the life or health of individuals in the facility. And as we've heard from testimonials today, the standard has been met here. We heard from Dr. Levitis Agababa in her letter that the American Academy of Pediatrics finds that secure detention of young children causes serious physical and emotional harm. And now with COVID-19, we know that families are currently facing unnecessary risks to their health and safety because of the pandemic. It's simply untrue that Pennsylvania has no authority to issue this ERO because Berks is detaining immigrants for federal immigration purposes. Berks is not a federal facility. It's owned and operated by Berks County based on a contract with the federal government. And because it's operated by the county, it's subject to state regulations. So Governor Wolf, for example, can send a letter to both Berks County and the federal government informing them that the facility cannot continue to operate in violation of state law. This letter could even provide a deadline by which the facility should cease to operate, with a threat that the state will shut it down if it does not. And while the shutting down of the facility itself would do nothing to change the fact that immigrants are still in federal custody, the effect would be that the feds would no longer be able to house them in a Pennsylvania facility. In other words, Pennsylvania has legal authority to decide how and under what conditions children will be detained in state, county, and private facilities. If Berks does not meet Pennsylvania standards, it can be shut down. It is then up to the federal government to release such families or transfer them to an out-of-state detention facility. So the bottom line is that Pennsylvania, not the federal government, has the authority to determine whether families and young children can be housed in county-operated facilities. The state regulations have already answered that question with a clear no. And so now it's time for Pennsylvania to enforce those regulations and say no to detaining migrant children within our Commonwealth.
Thank you so much for informing us of sort of the legal ramifications of keeping this family jail open and how we can close it. Thank you for everyone who's shown up. You are the ones who will help us pressure Governor Wolf to issue an ERO. So thank you everyone for showing up. Next, we are going to I'm going to be passing the mic to Ana Drayos, who is part of our coalition and is a local activist.
Hi everyone, thank you for being here. And we have heard from Dr. Elena, from Aldia lawyer, from Adriana about how Berks is functioning illegally with the threat of the coronavirus about to hit and cause so much devastation. The Shutdown Berks coalition has worked tirelessly for years, trying to convince Governor Wolf and his administration to shut
Anna, sorry to interrupt you. Can you speak a little louder?
Sure.
Thank you.
The Shutdown Berks has worked tirelessly for years, trying to convince Governor Wolf and his administration to shut down Berks, an unlicensed and illegal detention center. But he ignored our pleas and our demands. And when we pressed, he proclaimed his support for the immigrant community. He said that he'd like to shut the center down, but he has no authority. And each time we confronted him, his excuses changed. Now, with the family's lawsuit, we see his true color. He's not interested in shutting down Berks. He's interested in working with the Berks commissioners and Berks County to continue getting blood money from the federal government. There's no time for Governor Wolf's hypocrisy right now. No time for his empty words of support for the immigrant community. No time for excuses. Time is running out for the detained families and their young children. Where is your leadership, Governor Wolf? Your courage to do the right thing? Where is your humanity? How can you sleep at night knowing that the deadly pandemic is raging like a wildfire across the country, striking with impunity jails, prisons, and detention centers? How will you live with yourself knowing that you caused the death of innocent people? As I'll have you know that Governor Wolf joined the demonstrators today in Harrisburg to protest police brutality against Black and brown people. A nice photo op for him, just like Trump brandishing the Bible and preening in front of the St. John's Church in Washington, D.C. Doesn't Governor Wolf recognize the parallels of systemic racism and brutality toward our vulnerable and Black and brown communities? That having the authority to free the families and doing nothing about it, that he's no different than the brutal police officer who snuffed out the life of Mr. George Floyd, that his knee pressing down, that what he's doing, not freeing the families, is like his knee pressing down on these families' necks, suffocating the life out of them? Doesn't he have humanity in him? We, the people, demand that Governor Wolf issues an ERO and shuts down Berks, and we urge him to work with the commissioners to develop an institution that helps the community at Berks. We urge the legislators attending tonight's town hall to take action. We want to thank them for taking part in this town hall, but we want them to make a commitment to urge Governor Wolf to issue an ERO and shut down Berks. You can answer yes or no in our chat room. We would really appreciate that. We have to work together, legislators and community members, so that our immigrant community is not snuffed out by this pandemic. But again, the community, along with Shut Down Berks Coalition, as I said before, we have been working tirelessly to take action to shut down Berks. And here's some things that the community can do toward this effort.
Anna, can we take a moment to let the politicians who have joined us today type their response? Adriana, can you list who has joined us?
So we have on this call Representative Robb, Senator Schwenk, Representative Kruger, and Representative Hohenstein. And we are asking that you help us in pressuring Governor Wolf to issue an ERO. We would like you to tell us how you're going to help us do that on the chat box. Thank you, Anna. Thank you. Thank you, Representative Hohenstein, for showing up for our community and for making a commitment to help us pressure Governor Wolf. Anna, you were telling us how the community can keep getting involved and helping us pressure.
Yes, there are many ways that you can take action depending on your capability and your comfort zone. You can start, at a level of making a phone call to Governor Wolf, Secretary Miller, DHS Secretary Miller, Lieutenant Governor Fetterman demanding that they shut down Berks. You can write a letter or a postcard with the same demands. You can also visit the governor. Hopefully when things open up, when the state capitol opens up, you can have a visit. It's a beautiful building. He's located on the second floor, and his staff will, on the surface level, will welcome you. You can send a video message, or just take a selfie mode and record a short message of 30 to 60 seconds long, and urge Governor Wolf and his administration to shut down Berks. You can also organize a local event. Help spread the word by organizing together, hold a candlelight vigil in a central location. Put together a presentation for your church group. Ask your city council to issue a resolution calling the governor to issue an emergency order. And also you can support the campaign to shut down Berks. We have a website, Facebook. Reach out to us. We do have regular webinars, training, so that you can take it even further and lobby legislators and Governor Wolf to shut down Berks. Also change your profile picture, the shut down Berks butterfly. There's so many ways you can get involved, and we urge you to do so because people's voices are powerful, and Governor Wolf will hear you out. And we hope that he takes action right now, immediately, because the families can no longer wait. They are in dire circumstances. The coronavirus is about to strike, and there's no help for the families.
Thank you so much, Ana. As you mentioned, we are very active on social media, and we put out calls for action all the time. We have call-in days to the governor and to the commissioners, to the Berks County commissioners. So there's many ways to get involved. Reach out to us, and we will point you in the right direction. So you can help us pressure Governor Wolf into closing down this detention center and freeing the families that are in there. So we're almost done. We have just a couple questions. We're actually done with our speakers. Now I'm just going to read some of the questions that were in the chat box. One of the questions was, how many people are detained in detention centers? If anybody from the coalition wants to jump in and help me with this, you can do that. As far as I know, it depends. There's many detention centers across the U.S. Some of them host up to, I believe, like 300 people at one time. I think the family detention center here at Berks, I believe, is 100 to 90 beds. Please correct me if I'm wrong on that. So yeah, I hope that answered the question. Why are these families still detained? That's a very good question. Basically, political unwillingness to close down this detention center. As we heard from Professor Lee, there are ways that Governor Wolf can close this detention center down. The families are very likely just going to wait for their proceedings with hosts that are waiting for them in the US when they migrate. Why are they still detained? Political unwillingness and frankly money. This detention center makes money for people in the county, and goes the same for other detention centers. These detention centers make money.
Sorry, if I might add to what Adriana is saying, I think most of you have noticed that there is simply an unwillingness from this government, from this administration, to extend asylum to the people who deserve it. And let's face it, the people who are the most affected by these policies are Black and Brown people. And that is the reason why right now, I was trying to figure out how many people remain in detention right now. But I know that in family detention, just from talking to our partners, there's maybe a few hundred, and the vast majority of them are Haitian, because a lot of the policies that are coming out disproportionately affect Haitians because of the way that they must travel to get here. So that would be something else to think about.
Yeah, absolutely. Thank you so much for bringing that to the table, Adriana. I think it's really important for everyone to remember and notice and be aware of that, you know, the same violence that we are talking about here is the same violence that people are fighting out in the street. It's the same police state, it's the same violence against Black and Brown folks. And we just need to all keep pressuring for change outside and keep pressuring Governor Wolf to close down this detention center. Thank you everyone for showing up. I think we'll close it on that note. Like Ana said, there's a lot of ways to get involved. You can follow us on social media, and we have, you know, action items all the time. So thank you everyone, and have a good night, and we'll hope to hear from you.